The Nimbus 3 is perfectly suited to all care environments, whereas the Nimbus 3 Professional offers increased functionality and is more appropriate for acute patients in specialist care environments like ITU. The Nimbus 3 and the Nimbus 3 Professional can be used for patients weighing up to 250 kilograms, which is 39 stone or 545 pounds, and are suitable for the prevention and management of pressure ulcers. In the case of patients with unstable fractures, advice should be sought from the appropriate physician before using the Nimbus 3 and Nimbus 3 Professional systems. Both the Nimbus 3 and Nimbus 3 Professional are fully integrated systems offering dual modes of operation: continuous alternating therapy or static low pressure therapy. The Nimbus 3 Professional has the additional valve controls for extended periods of targeted pressure relief. For the Nimbus 3, there are two modes of operation: dynamic alternating and static low pressure. Dynamic alternating mode is the default setting, which provides pressure redistributing performance for the patient. This mode should be used for most patient care cases. In dynamic alternating mode, the support surface beneath the patient cycles in a 1-in-2 cycle every 10 minutes. So, when one cell is inflated, the adjacent cells are deflated, which is referred to as a 1-in-2 system. After 4.5 minutes, the inflated cells deflate and the deflated cells inflate. This takes place over a 30-second period known as crossover. This means the patient is completely stable at all times during the dynamic alternating therapy. The second therapy mode is static low pressure, which provides a stable, non-moving support surface for instances where a dynamic support surface is not suitable to the patient's care regime. In static low pressure mode, all cells are equally inflated and level, and the support surface remains at a constant pressure. On the Nimbus 3 Professional, the pressure care regime is tailored to the individual patient. The mattress is 8 inches deep for superior patient support, and if the extra pressure relief is removed, the patient benefits from an air-filled base instead of a foam one. The Nimbus 3 mattress is made up of 20 polyurethane cells in 4 clearly defined sections, aligned in order from the head to the foot of the bed. Here at the head end are the 3 head cells, which remain at a constant pressure for pillow stability and patient comfort. The remaining 17 cells are the 8 torso cells, 4 thigh cells, and 5 Heelguard cells. The torso cells and the 4 thigh cells are of our deep cell figure-of-8 construction. The bottom chamber of the cells remains filled, whilst the top chamber alternates. These are called anti-sink torso cells, preventing the patient bottoming out and providing support whilst lying down and in the sitting position. The leg and heel cells are different to the torso cells in that they need to apply lower pressure. This is because of the bony aspects of the heel and lower legs. For this reason, they feature power-down straps, which quickly pull the cells down, removing pressure from the heels more effectively. The Nimbus 3 Professional differs in that the tri-cell head section consists of power-down cells for rapid deflation. The system enables a patient to be placed in the prone position, with pressure removed from at-risk areas, including abdomen, genitalia, and toes. The other key difference to the Nimbus 3 is that all the torso cells in the Nimbus 3 Professional have these individual valves, allowing them to be independently deflated to assist with specific pressure areas and patient care management. Individual cells can be deflated by rotating the valve controls. When the arrow is pointing upward, the valve is closed and the mattress operates in the normal dynamic or static modes. When the arrow is rotated to point downwards, the valve is open, allowing the cell to deflate. Only 4 non-adjacent valves can be opened and the cells deflated at any one time during patient therapy, and no 2 adjacent cells should be deflated at any time unless carrying out patient management activities. The valves really come into their own for targeted and sustained elimination of pressure from wound sites and other sensitive areas around the body, assistance with accessing difficult body sites for carrying out everyday nursing procedures, and for assistance with running feed lines and drains to and from entry points without risk of occlusion. Moving patients on and off the mattress can be assisted by deflating up to 4 of the cells in the torso region. Beneath the torso cells is the AutoMatt Sensor Pad. This highly responsive pad continually monitors the patient's position on the mattress. Any movement is detected and the cell pressure automatically adjusted to provide comfort and support. On the Nimbus Professional, like the mattress, the AutoMatt is fully encapsulated for infection control and ease of cleaning. The structure of the mattress is modular, with a popper system that securely locates the individual cells. This allows any cell to be quickly removed or replaced during cleaning or periodic servicing, keeping the system constantly in patient service. The underneath of the base cover is finished with this special support material to assist with profiling to the bed frame. In the event of cardiac arrest and CPR needing to be administered, all you need to do is lift the red CPR handle, turn the handle counterclockwise and pull the handle away from the panel. The grey triangular seal will rotate and the air will be immediately exhausted from the mattress. To reset the CPR, turn the grey triangular seal clockwise and push onto the connectors. Turn the red handle clockwise and then fold the handle flat to lock it into position. The transport mode control is located at the foot of the bed, next to the CPR control. Simply turn the transport control knob clockwise to transport, turn off the pump, and disconnect the tube set. The patient will remain supported by the mattress for up to 12 hours. To resume normal operation, all you have to do is reconnect the pump and the tube set to the mattress. Then turn the transport control knob counterclockwise to the normal position and turn the pump back on. When static mode is selected, the yellow indicator on the button is illuminated, and when in dynamic alternating mode, the yellow indicator goes out. Moving across to the right side of the control panel, we find the comfort control. This allows small changes to be made to the patient's comfort without affecting the dynamic support surface. By turning this clockwise, you can increase the overall firmness of the mattress. Turning it counterclockwise softens the mattress again. Moving back towards the centre of the control panel, we find the indicators for the alarm features of the Nimbus 3 and the Nimbus Professional. The pump unit incorporates a sophisticated alarm detection system that differentiates between patient movement and genuine alarm conditions. Whenever an alarm condition is detected, the red alarm triangle here starts flashing together with an indicator of the cause of the alarm. An audible warning will also sound, which can be cancelled by pressing the alarm mute button here. There are several alarm conditions which relate to these different indicators. The high pressure indicator here is illuminated whenever the pump detects high pressure within the mattress. The reason for this could typically be that the AutoMatt Sensor Pad is not working correctly, or there is an occlusion or kink in the tube set. Next to this is the low pressure indicator, which illuminates whenever the pump detects low pressure in the mattress. This may indicate that there is insufficient pressure to support a patient. The cause of this could be a problem with the alternating cells, the CPR valve has been left open, the tube set is not properly connected, or that the transport control is turned to the transport position whilst the pump is switched on and connected to the mattress. the low pressure indicator will be switched off once normal pressure is reached. Below the low pressure indicator is the pump fault indicator, which is illuminated when an internal pump malfunction is detected. The fault can only be rectified by carrying out a service on the pump. The power indicator, here, will flash when the failure in the mains electricity supply has been detected. The alarm will continue until the mains power is reinstated or the pump is switched off using the power switch on the pump control panel. For all alarm conditions except power fail, once the alarm condition has been detected and displayed, it can only be cancelled by switching the pump unit off and then back on again with the main power and alarm reset switch. Finally, this is the weight indicator. When this is illuminated, the mattress is being inflated and will remain illuminated until the mattress has been fully inflated. This may take up to 15 minutes. Thank you for watching this demonstration about the Nimbus 3 and Nimbus 3 Professional